Hi, Dr. Ken Ferguson here from Oliver Chiropractic Wellness Clinic. Now here's a scenario I've heard in my office many times. You are sitting in your car, stopped at a traffic light or maybe a stop sign, or maybe you're waiting to merge into traffic. Suddenly a vehicle rear ends your car. The impact isn't hard. You take a look at your car and you see that there's minor damage or no damage at all. The bumpers seem to have absorbed the bulk of the energy from the crash, so they essentially protected your car. Now, maybe you feel a little stiff, maybe a little startled or shocked. Now, you shrug it off, reasoning that it is from the unexpected jolt from the accident. After all, they didn't hit you that hard and your car is fine. You exchange information with the other driver and you go on your way. Now, over the next days and weeks, it's an entirely different story. Maybe now your neck is painful and stiff, and you may have pain in your shoulders and back as well. You may have in fact suffered a whiplash injury. Low-speed accidents, especially low-speed rear-end accidents, have the potential of causing whiplash injury. Visiting your chiropractor for an assessment and diagnosis and a treatment plan as soon as possible is important. In our office, our exams is focused on assessing your spine and nervous system function, as well as any soft tissue injury. Treatments may involve chiropractic adjustments, exercise recommendations, massage therapy, acupuncture, or physical therapy referrals. If you or someone you know has been involved in a rear-end accident and are suffering from whiplash injury, give our office a call and schedule an appointment with one of our experienced chiropractors as soon as possible. To contact us, give us a call at 780-455-2112 and our helpful staff will get you started right away. Thanks for watching. Take care.